Dr. Rupi spoke with Express.co.uk about irritable bowel syndrome and the low-FODMAP diet, a strategy to limit the symptoms. The low-FODMAP diet restricts fermentable carbs. This includes wheat, legumes, garlic, onions, milk, yogurt and soft cheese, mangoes, figs, honey and blackberries, and lychees, among some others. Dr. Rupi said, "I always treat it as a diagnosis of exclusion because it's also super restrictive. You can't have onion, for example. It's one of those things that if you're gonna do it, you probably need support. It's not a long-term fix, it's a transitionary diet. FODMAP is something that you do for a certain amount of time, but then you reintroduce very slowly other ingredients." Dr. Rupi added, "I always think it is a worthwhile thing to go speak to your GP. Make sure you're getting things excluded." In fact, the health professional previously advised about when to see a GP if you are experiencing bloating. He said, "The topic of bloating is a really important one, and I think it sounds like a trivial subject, but in a lot of cases, bloating has nothing to do with the gut. It could be due to sinister causes. So, whenever anyone comes and sees me as a GP, I'm always thinking about red flags. Is this cancer? Is this gynecological stuff? Is this something in your diet, something that you have an intolerance to? Is it psychological? The suite of different things that can cause both is really varied. So, I think that the most important thing people should be aware of is bloating is not a trivial symptom." What is IBS? IBS is condition affecting the bowels. The cause of IBS is unknown, but it has been attributed to a sensitive gut and stress. Those who suffer from IBS tend to do so for most of their life. It can be very painful and debilitating. IBS symptoms: there are a number of symptoms of IBS, which you may notice flare up after eating certain foods. They include stomach pain and cramps, constipation, diarrhea, bloating, flatulence, passing mucus, feeling tired, feeling sick, backache, incontinence. Treatment: IBS can't be cured, but there are ways to diminish the symptoms. These include exercising regularly, eating small meals, avoiding caffeine, avoiding spice and avoiding stress.